Good morning all. Today we will learn regarding psychiatric disorders in pregnancy. So pregnancy is generally thought to be a time of happiness and emotional well-being for a woman. However, for many women, pregnancy and motherhood increase their vulnerability to psychiatric conditions such as depression, anxiety disorders, eating disorders, and psychosis. As we know that in pregnancy, the woman is more chance to get depression and anxiety disorders, psychosis, and some of the eating disorders also. So first we will see the definition of the depression. Depression is a state of low mood and aversion to activity. It is classified medically as a mental and behavioral disorder. The experience of depression affects a person's thoughts, behavior, motivation, feelings, and sense of well-being. So, depression is a state of low mood and aversion to activity. And also, it is classified medically as a mental and behavioral disorder. And the experience of depression affects a person's thoughts, her behavior, motivation, feelings, and sense of well-being. So, next we will see the definition of the anxiety. Anxiety is an emotion characterized by feelings of tension, worried thoughts, and physical changes like increased BP. So, anxiety is an emotion characterized by feelings of tension, worried thoughts, and physical changes like increased BP. So, eating disorders. Eating disorders are illnesses in which the person experiences severe disturbances in eating behaviors and related thoughts and emotions. Eating disorders are illnesses in which the person experiences severe disturbances in eating behavior and related thoughts and emotions. Psychosis. Psychosis is a mental health problem that causes people to perceive or interpret things differently from those around them. This might be involved some of the hallucinations. So next we will see regarding the types of psychiatric disorders in pregnancy. So in pregnancy, depression, anxiety disorders, eating disorders, and psychosis. So first we learned regarding the definition of the depression. So according to the American Congress of Obstetricians and Gynecologists, between 14 to 23% of women will struggle with some symptoms of depression during pregnancy, and also a mental disorder characterized by episodes of all-encompassing low mood accompanied by low self-esteem and loss of interest or pleasure in normally enjoyable activities is called depression. Although up to 70% of women report some negative mood symptoms during pregnancy, the prevalence of women who met the diagnostic criteria for depression has been shown to be between 13.6% at 32 weeks gestation and 17% at 35 to 36 weeks gestation, peak through first and third trimester. So the risk factors for depressions are having a history of depression, age at time of pregnancy, living alone, having limited social support, experiencing marital conflicts, and feeling ambivalent about pregnancy. So the risk factors for depressions are having a history of depression, age at time of pregnancy, living alone, having limited social support, experiencing the marital conflict, and feeling ambivalent about pregnancy. So what are the signs of depression? So first sign is persistent sadness. She may feel sadness all the time and difficulty in concentrating in her activities, sleeping too little or too much, loss of interest in activities that you usually enjoy, recurring thoughts of death, suicide or hopelessness. Then she may feel severe anxiety, then feelings of guilt or worthlessness, then change in eating habits. So the main signs of depression are persistent sadness, difficulty in concentrating, sleeping too little or too much, loss of interest in activities that you usually enjoy, recurring thoughts of death, suicide or hopelessness, anxiety, feeling of guilt or worthlessness, and change in eating habits. How we can manage depression? So there is non-pharmacological treatment and also pharmacological treatment. In non-pharmacological treatment, there is psychotherapy and behavior therapy. In pharmacological treatment, there is tab citalopram 20 mg per day may increase to 40 mg per day. Tab sertraline 25 to 50 mg per day may increase to 200 mg per day. So, pharmacological and non-pharmacological treatment are there. In non-pharmacological treatment, there is psychotherapy and behavior therapy. In pharmacological treatment, there is tab citalopram 20 mg per day how to give, and it should be increased up to 40 mg per day. Then tab sertraline 25 to 50 mg per day, and it can be increased to 200 mg per day. So this is regarding the depressive disorders. Hope everybody understood. For more videos, please subscribe the channel and please share to your friends. Thank you. Next video, we will deal regarding the anxiety disorders.